Hey guys, welcome to another episode of Doctordle. I'm Timothy and I'll be answering today's question. A 40-year-old man presents to the ED emergency department because of a new onset headache. So, new onset, she has not had something similar before. So, try and classify. Is it a primary headache? No, is there a secondary headache to other causes? Is it the major three, the migraine headache, the cluster headache? So, what could it be? Let's just go with cluster headache. Cluster headache. I think we've answered the cluster headache before. So, will they repeat that assessment? That's not likely. The headache starts at 4 hours in one. Feeling successful. So, I automatically will go with a migraine headache. Because a migraine headache usually lasts for 4 hours to 72 hours in some cases. Migraine headache is worse with bright lights, sometimes with noise, causes patients feel like they're trying to throw. It's a new onset headache that's usually on one side of the head. So some of these things are very much similar to what we would expect. It might not be it, but I think it is. Okay, it's not it. Okay. So past medical history includes type 2 diabetes, mellitus, hypertension, and HIV. And he's not been able to afford this medication for many years. So now, so many things could be going on. Is it hypertension that's causing this? And all patients with uncontrolled blood pressure and pains of headache, could he be having a secondary headache, right? Perhaps due to an infection that's currently ongoing. And there's no really particular. So let's see, hypertension, intracranial hypertension. No, I don't think this is it. But, so temperature is 101, heart rate is 97 BPM. So it looks like it's getting more septic. Local rigidity. So local rigidity helps me to really think better now. So he's having a new onset headache, photophobia. He's not on medications. He's a huge patient for immunosuppression and opportunistic infection. I think he has meningitis, but from what cause? Is it a bacterial meningitis or is it a fungal meningitis? This guy has diabetes and HIV. So I'll go with the common things for common. So yeah, there's a lot of types of meningitis. So I'll go with Neisseria. We've answered meningitis before. I don't think it's going to be this. Yeah, it's not. So, a normal puncture reveals elevated urine pressure, Indian infections, and encapsulated yeast cells. So, it's a fungal. Staphylococcus. That's one of the main meningitis. I'm going to be surprised. Cryptococcus Neoformans. Let's see what exactly it is. This sounds just like the name of the bacteria. It's an encapsulated yeast causing opportunistic infection and notably meningoencephalitis. Okay, obviously I was expected to go to the mechanism, but I know it's a form of meningitis, or in this case, a meningoencephalitis caused by inhalation, symptoms, headache, fever, alternate mental state, stiffness. So work up with Indian thing. So those are some of the things I guess would have been like a pointer. Excessive anti-testing culture. So the treatment involves amphotericin B, food C. fluid cytosine induction followed by fluconazole conjugation. So it's a fungal infection and HIV and TB, HIV and diabetes patients. Headache, photophobia. It's an interesting thing. It's not always a bacteria. So I think this was a good one. Do better next time. Cryptococcus Neoformans. So have a wonderful day and see you guys in the next one. Cheers.